Okay. So your timing starts now. Just a second. Let me put on the time. Okay.
I knock the door, enter the room, give my sticker to examiner, sanitize my hands. Hi, I'm Dr. Sabine Gill, physician on duty today. How may I address you?
You can call me Sarah.
All right, Sarah. So, Sarah, during the course of our conversation, I'll be taking few notes. Is that okay with you?
Yeah.
Okay, thank you. So, Sarah, what brings you in today?
So, doctor, I'm having this chest pain from couple of days, and it's just bothering me so much. Can you
Mhm.
help me today?
Sure, Sarah. I'm so sorry to hear that you've been experiencing it. When did you start having it?
So it started like a week ago.
A week ago, okay. And Sarah, in this past 1 week, have you gone to any physician for your pain?
No,
Okay. So, Sarah, how did it start? Was it sudden or gradual?
it was gradual.
Gradual, okay. And do you have this pain all the time or does it come and go?
I mean, before it comes and goes, but now it stays all the time. So even right now, doctor, I'm having so much pain. Can you help me?
Sure, Sarah. I'll just be asking you a few questions and then we can formulate a plan. How does that sound?
Yeah, sounds good.
Thank you. So, Sarah, is there any particular time of the day you feel the pain is worse?
I think when I woke up in the morning, it's worst.
Mm-hmm. And can you show me where exactly are you having this pain?
It's in the middle of my chest.
Okay. And is this pain shooting anywhere else?
No.
Okay. How would you describe the quality of this pain?
What do you mean quality of this pain, doctor?
Oh, sure. I'm sorry. I would elaborate it. Is it like burning or sharp?
I would say it's a sharp pain.
Sharp pain. Okay. And is there anything that you've tried that has made it better?
Uh, I haven't tried anything so far, but I feel like when I just like lean forward, then
Mm-hmm.
it gets a little better.
Okay. And is there anything that worsens it?
Yeah, when I think I just lie down, I get
Mm-hmm.
worse. Yeah,
Okay. And Sarah, with time, is it progressively getting better, worse, or it's the same?
it is getting worse.
Okay. On scale of 1 to 10, 1 being the mild and 10 being the worst, how would you rate this pain?
6.
6. Okay. Sarah, have you had any trauma to your chest recently?
No, doctor.
How about any fever in the past few weeks?
I feel like I'm little like little feverish, but
Mm-hmm.
I didn't check my temperature.
Okay. And have you had any flu-like symptoms?
Like, what do you mean by flu-like symptoms?
For example, any runny nose?
Yes, like 2 weeks back, I
Mm-hmm.
had sore throat. Yeah,
Mm-hmm.
but it
Okay.
went away by itself. I didn't do anything.
You didn't do anything. Okay. Sarah, have you had any nausea?
No,
Any vomiting?
no,
How about any sweating?
no,
Any cough?
no,
Okay. How about any calf pain?
no.
Okay. And have you had any feeling of like your heart is racing?
Sometimes, yeah,
Mm-hmm.
sometimes I do feel like.
Sometimes. And do you feel there is any trigger to it when you say sometimes?
No.
Mhm. And have you felt any difficulty in breathing?
Sometimes when I'm having this chest pain, I feel like
Mhm.
it's hard to breathe.
Okay. And is it when you are sitting or when you're walking?
No,
Okay. And have you noticed any changes in your urine recently?
no,
Any pain in your belly?
no,
Any changes in your bowel habits?
no,
Okay. Sarah, any past medical history I should be aware of?
no.
Any medications that you're currently taking?
I just take vitamins.
Vitamins? Any over the counter medication like oral contraceptive pills?
No, not right
Any?
now.
Okay. Any allergies to any medication?
No.
Okay. Any family history of any heart related problem?
My father, 60 years, when he was 60 years old, he had a
Mhm.
heart attack and he had
Mhm.
a bypass.
Okay. Okay. And how is he doing now?
Yeah, he's doing fine.
That's great. Just few questions regarding your social habits, Sarah. Do you smoke?
No.
And how about any alcohol consumption
Occasionally,
occasionally? And any recreational drug use?
yes, occasionally.
Okay. And what do you use?
Opioid.
Opioids, okay. And what is the route of like administration? Like, how do you take it?
I think I take some injections.
Okay. And when was the last time you had it?
1 month ago.
1 month ago. Okay. Thank you for sharing all that information with me, Sarah. So, Sarah, what do you expect from this conversation today?
So, doctor, I already told you I'm having this chest pain. I want you to help me as soon as possible.
Sure. So, Sarah, based on your history, I would have to do a physical examination and run some test and investigation to see what is the cause of it.
Okay.
And based on that, I would be in a better state to answer your question. Is that okay with you?
Yeah, sounds okay. But what I should be doing right now, I'm having so much chest pain that I am unable to sit right now.
Sure, Sarah. So first of all, I'll start with doing your basic investigation. First of all, I'll be assessing your airway, breathing, and circulation to see if you're hemodynamically stable. And after that, there are chances I would have to admit you and run some tests and investigations and formulate a plan. And meanwhile, I'll be giving you a painkiller to help you to ease the pain.
Okay.
Okay.
So, do you think I should be at this point taking anything?
Um, at the moment, Sarah, I feel like we have to do the testing first
Okay.
and then do the medication point of view.
And doctor, if I have to, like, if you come up, like I told you so many questions, do you think I have some sort of any disease that I should like know right now?
Sarah, based on what you have told me, I'm thinking that there is some kind of, swelling around your heart that is called as pericarditis. Based on that, that is why you're having this chest pain. But I would have to be 100% sure. I would have to do a ECG and do some cardiac enzymes and see what is the cause of it.
Okay. Is it dangerous?
Well, Sarah, it is not dangerous. It is just it's a like a it's not dangerous, but I cannot be 100% sure. But right now, all I can say is we can start you on some medications, and after we rule out any other organic cause, we can start you on medications, and I will follow up with you in 2 weeks.
Okay, sounds good. So is that's it?
Yeah.
Okay. So you still have 37 minutes left and you did really well. So I will ask you 3 questions and after that I will tell you what you did wrong, okay?
Okay.
Okay. So based on your history, what was your two differential diagnosis?
So first is acute pericarditis, and my second is infective endocarditis.
Okay. And what is the investigations you would like to do at this point, if any?
Sure. I'll be doing CBC with differential serum electrolytes, BU and creatinine, and I'll be doing ECG, cardiac enzymes, and chest X-ray.
Okay. And if the patient, like I show you ECG, let's suppose I don't have any ECG right now, and it says ST elevation. So based on your investigation, sorry, ECG, what is your diagnosis right now?
If it is ST elevation,
On
then
all of the leads, on all of
yeah,
the diffuse ST elevation, okay?
acute pericarditis.
Okay. Okay. Since I mean I don't have any ECG right now, so what they will do, they will actually show you ECG and ask you to interpret it. Okay. I will
Okay.
show you how to interpret the investigation, sorry, whatever the X-ray or ECG. I mean, you
Mhm.
need to know particularly how you're going to start with the thing. Okay,
Mhm.
let's start with your problems at this point. I mean, if I would say you were doing really well, but
Mhm.
if somebody says that I am having chest pain right now,
Mhm.
you
Mhm.
cannot continue asking questions. I mean, he said, I am uncomfortable. She said, I am uncomfortable. I'm having chest pain right now. I cannot sit properly. You
Mhm.
know how uncomfortable for her to sit down at this point if she is having chest pain and she keeps on saying that I'm having chest pain. Like I repeated it 3 times.
Mhm. Mhm.
So you have to tell, just bear with me for 2 to 3 minutes.
Mhm.
After that, I will give you some medications. But before that, I would like to ask you some questions. What
Mhm.
will happen at this point? If you say these words, she will actually stop down. What I want, because why I was keep on repeating that I am having chest pain, because I want you to give me some reassurance. It's not
Mhm.
like I'm having chest pain at this point. Over there in the exam, they actually start pretending like they are having chest pain really bad. I
Mhm.
wasn't showing any signs, but they actually started it and they stop giving you any answers if you don't give any reassurance. You
Mhm.
know what I mean? So you will lose a lot of time because of that 1 or 2 words of reassurance if you don't say that. And it says focus history. When it says focus history, you have to stick with the chest pain. If let's suppose asking about abdominal pain, asking about these things will help you with the diagnosis, then ask. Otherwise, there is no point of asking about your abdominal pain, about your urine, about those things. This is focus history. Okay. Otherwise, you did really well, I would say. But in the start, the problem was you could have asked, can you tell me more about your chest pain? She could have told me so much things that you don't have to ask one by one in each question.
Okay.
Okay. And other than that, you don't have to say, what is the quality of the pain? What is this? What is that? The next person is not an examiner or a doctor. They are patients like us. So if you use something like complicated term, they won't be able to tell you. So you're getting my point. And first of all, in this scenario, like try to make your differential diagnosis and then rule out one by one. Okay. So if you keep on asking that, and I think you didn't even ask how did it started, what were you doing at that time, right?
Yeah.
You can ask it. So you can have asked it like what was she doing at that time. Then you don't have to ask when you were walking it was increased, when you were laying down it was decreased. I actually added those things by myself when you said, is there anything that help you decrease it? If let's suppose I said no, then you have to particularly ask, is there any position that help you to decrease or increase it?
Yeah.
Because sometimes you have to ask very focused questions, then they will give you answer. They don't give answers on unfocused questions, like they want you to rule out these things. Even when you are asking about investigate let's suppose you talk about if like substance abuse. So if you ask about and these kind of questions you cannot directly ask it. You have to ask, I'm going to ask you few sensitive questions which I ask from every single patient. Is it okay if I ask you? Okay. And you didn't even rule out sexual history, maybe pericarditis from some infection that she got from sexual history. Okay. So that is also very important. So causing of an infection. And when you are explaining about pericarditis, if you are unsure what actually pericarditis is, don't tell that this is a swelling. It is actually an infection of the pericardium or the sac around the heart. So you were telling it the wrong way. So if you are not sure, don't say it. Okay. If you're not sure, don't explain it because the patient is not going to know anything. And other than that, she is in clinic. How are you going to admit it here? You said, I'm going to admit you. Believe me, if you said you are going to admit the patient in clinic, you won't be able to get any mark. Okay, this is your common sense question. They don't want you to do that. If you do this clinic and admission and you said airway breathing circulation, do you think a patient who has airway breathing circulation is sitting down and giving you history? So you cannot say, because airway breathing already been assessed when she was talking to you. So if you're still saying that I'm going to do airway breathing, the examiner will think that you are so out of focus that you were just not focusing on what she is saying. Okay, this is basically a bad communication skill. I know your knowledge is very good, but what problem comes here is basically your way of communication, your way of thinking the next person, how critical the condition is. Okay? And your differential diagnosis was good. Your investigation was good as well. So if she is coming in, same patient is coming in emergency. Okay, let's suppose the patient is coming in emergency. So then your investigations would be starting from the ECG, chest X-ray, cardiac enzymes, then CBC differential electrolytes. And don't do airway breathing circulation, the patient who is speaking. Okay, because he's speaking, his airway breathing is good. If you go to emergency chapter, there is written.
Yeah.
A patient who is speaking, their airway is considered that they are good. Okay. Anybody who has any question at this point in this case? So and whenever the patient is saying stop right away, if he's stopping you and asking you, I am having chest pain, just ask them, be it with me for a few minutes. Can you? Okay. So ask the next person if he's comfortable to give you more answers. And focus means focus, stay focused. And I think we didn't even ask about weight loss. These are red flags. So talking about the fever, weight loss, diet, these are very, very important. You cannot miss the red flags. Okay, even though she is 29, cancer is very unlikely, but weight loss could be many of the causes. Okay, so don't forget about those ones. And their exercise routine, how how much she can walk around, how active she is. And if that she said she is having a heart beating problem like palpitations. So if she thinks she's having palpitations, ask her if she has any recent stresses in her life, because this chest pain could be cause of anxiety, panic attack. In 29-year-old, it's very common, especially in women. So you didn't even ask any question about her stress in the life. So panic attack is one of the important thing. Okay? And one more question. Sorry about that. I keep on forgetting that. Did you ever have this chest pain in your life back then, or is this the first time you are having it? Okay, so you can rule out a lot of things when you are having it again and again, again and again. So this is linked with someone. Yes, Dr. Zukra, you have any question?
Yeah, you kind of answered my question, but still, for example, from few comments of the patient, we already knew that it's pericarditis. But do we need still to ask her questions to rule out something else?
Yes, for sure. Yes, for sure. You have to. I mean, you can ask. That's what I'm saying. If you ask her, is this the first time? You can ask about panic attack. If this is having a chest trauma, then you can have panic attack. Otherwise, because if they ask you, what are your differential diagnoses? What will you say other than pericarditis? You haven't ruled out anything.
Oh, okay.
Okay. So they can ask you directly, what was your diagnosis? If they don't ask you, they said can ask you differential diagnosis. But if you haven't ruled out any differential diagnosis, what will you say in the post encounter question? Okay. So panic attack is very common. Cocaine abuse is very common because cocaine causes MI. Then this pericarditis, I'm telling you the differential diagnosis. If somebody is interested, they can write it down. A 29-year-old can have panic attack, cocaine abuse, MI, and then this one, acute pericarditis, then DVT, because if they're taking OCPs or something like that, then pulmonary embolism. Okay. Somebody else who has a question, sorry, I couldn't answer it right away. I'm not able to hear you. So you cannot hear me? Anybody who else has a problem with my sound system? Anybody else?
Good. No, it's all good. Doctor, you need probably to log in again.
I need to, okay, she.
No, not you, whoever is not hearing.
Okay. Okay, let's move on to the next question. I hope I answered all of your questions here. So your flow was really good. I would really appreciate that you were not getting confused at this point. It was really nice, but try to be more respectful to the next person who is telling you have chest pain. This is very one of the thing. If you ignored whatever the patient is telling you to you or SP is telling to you, this is basically a bad communication skills, and you might not able to score good marks because of that. This is very important. Your knowledge comes second, your next of the things comes second, but being assured by the patient, they solved a lot of problems. If she's having a panic attack, let's suppose right now, and she's unable to do anything because of that, and even you have to can ask if you are having any shakiness, any trembling, any these kind of things along with it, so you can rule out a lot of things. Just stay focused. Okay, when they says focus, if they don't say focus, then you can ask about anything. If they says only take her history in the next 8 minutes, so you don't want to like go anywhere else, just stay with the point. And when they said history in 8 minutes, there are supposed to be some concern that you need to ask. It was really nice that she asked her, what do you expect from today's visit? That was really a nice question, so she could ask about if she's any concern or anything. And let's suppose I'm giving you some hint here. Let's suppose you did so much questions and you couldn't come up with any diagnosis. We could, these kind of problems could happen. So if let's suppose you asked so many questions and you couldn't come up with any like any diagnosis, like you were going with the DVT, you were thinking of cocaine abuse, then what should we do? What I would suggest here, you can ask kindly, and here I would say whatever the woman told you your name, you can like keep on repeating it. Miss Sara, if you would like to tell me anything that would help me in the history, that would be really nice. Maybe she will add something that will help you with your diagnosis. Let's suppose I asked so many questions in the 8 minute and I couldn't come with any diagnosis. So now I am confused and stuck in the middle. I don't know what you should say because the time is over and I don't have anything. So what you can do here, Miss Sarah, is it okay if you can add something here in your history which might be important for me? Simple. She might add so much things in the thing that will start thinking you of going in that direction. Because sometimes we got lost and we don't know what we need to do here. So you can ask, is there anything else that I'm missing and you want to add in the history? Or you cannot say like I'm missing. You can say if there is anything else that you want to add in your history that will help me in the diagnosis. She might add you, I'm having cough, doctor, I'm having this, I'm having that. Okay. So this will also help you to build your diagnosis. Now moving on to the next question, which is basically concern. So I think Dr. Tuba messaged me for that. So Dr. Tuba, you want to go with it? Anybody else? Dr. Tuba. Okay, Dr. Tuba is going to go. So I'm going to put on 2 minutes. So then you can start. So meanwhile, I would suggest to make your own differential diagnosis for 29-year-old, 53-year-old, 75-year-old, because every age there is different kind of disease that can present. So you don't have to rule out heart failure in 29-year-old, okay? But you need to rule out acute pericarditis, cocaine, MI, panic attack. These are very common in the young patient. So try to see in each young patient, there will be a lot of them. And sometimes they give you the name and sometimes they don't give you the name. So when you enter, you have to ask, so how do you want me to address you? And one more thing here, if let's suppose they said a 29-year-old woman came to clinic with some concern, take her history in next 8 minutes. So in that, you even have to ask what is your concern or what is your problem that you are coming here. So be prepared for everything. They might not give you anything on the sheet like that is written outside a note, but they might can give you everything. A 29-year-old Sarah came to you with the clinic and everything this. Okay, so be prepared for both of the things. Okay, your time is over. Now, next 11 minutes, you have to talk. Are you ready?
Yeah. Knock, knock, I come in, hand over my candidate, go to the examiner, sanitize my hands. Hello, I'm Dr. Khan. Can you confirm with me your name and age, please?
Yes, I am 46-year-old and my name is Mike.
Mike. So Mike, how are you doing today?
Not bad, doctor. I'm doing great. How about you?
Good, thank you. I'm fine. So I see you're here with some concern. Is that correct?
Yes, doctor.
All right. So before we begin our interview, Mike, I would like you to know that whatever we discuss today will remain confidential between you and me. Is that okay?
Yes.
All right. So please tell me, how can I help you?
So, doctor, I don't want to like I'm really embarrassed to say this at this point, but I mean, I'm having problems with my wife.
Mm-hmm.
So, what happened is I'm suspecting that my wife might have some, some affair with somebody else.
Okay.
So that's why I came here. I mean, I want to do some tests. I want you to do some test on me to see if I have some, some problems going on with my private area, because I am having some sort of discharge from couple of days.
Right. Right. So first of all, I'm so sorry, Mike, whatever you're going through. It must be really like a difficult situation and difficult timing on you. But I'm glad you're here. So we'll discuss this more and we'll get to the bottom of it. Is that okay?
Yeah.
All right. So tell me about your discharge. For how long you've been experiencing this discharge?
I understand, doctor, you are more concerned about my discharge, but I just want you to talk about, like, is there any way I can find out that my wife is cheating on me?
I am sorry. In this regard, I won't be able to help you, as I can't say if she's having an affair or not. But because I am your doctor, I can totally help you out with your concerns.
Okay.
So,
So
yeah.
let's suppose if you do my test and you come up with some infection, because right now I'm having discharge, so definitely I have some sort of disease going on. I
Right.
might get infected because she might have some problem with somebody else or like affair with somebody else. So if I come up positive, do you think my wife is like can also get those tests and you can do that?
It's a totally valid concern, Mike. First of all, as I said, I'm glad you're here so we can get you tested and help you with your, if there is any infection going on with you. But if it is about your wife, I cannot really say anything as I haven't seen her or I don't know anything about her right now. But if there is anything that comes out with you, I would definitely would encourage you to discuss this, your problems or concerns with her as well. And then I guess communication is the best way to find out anything. So this is all I can help you with. Do you understand?
Yep, I understand.
Right. So is that okay if we go forward with the questions?
Sure.
All right. So tell me about it. Is it the first time you are having this kind of discharge?
Yes,
Okay. And for how long you've been experiencing this?
from 5 days.
All right. And can you tell me the color of this discharge?
I think it's just the white.
Discharge. Okay. And is it like continuously coming out, or is it like any specific time that that it appears?
It's sometimes just continuously most of the time.
Okay. And is there any other thing like bleeding or anything with the discharge?
No.
Okay. And can you tell me how much is the discharge?
I mean, I don't know how to quantify it. Like, uh, maybe you can say 1 spoon, 1 full spoon.
Right. And is there any pain while there is a discharge?
No, not with the discharge, but I would say when I pass the urine, then I have pain.
Right. Yeah, this is where I was going to ask more about your urination. If you've also, so you said painful urination, right?
Yes.
Um, any problem like any burning while urination?
Yes.
Okay. And have you been going to urinate more than you used to?
Yeah, sometimes I feel like I have done passing urine. So
Mhm.
then I feel like I have to do it again. So yeah, I have keep on going back and forth from the bathroom from last whole week.
Right. So are you saying you feel like your bladder has not finished, completely finished urination?
Yeah, I would say like even after passing the urination, like passing my urine, I feel like there is some drops that is left and I need to go back. Yep.
Right, right, right. Okay, and do you feel any pressure in the lower pelvic area?
No,
And this is a bit personal question, but I just want to know if you've had any problems with erection.
no.
Okay. Mhm. All right, and have you noticed any dribbling while you are urinating?
No.
Okay. So, and have you had ever any other infections before? Any infections like STI before?
No.
No.
What
Okay.
do you mean by STIs?
Any sexually transmitted infections in your life?
No.
Okay. And again, Mike, I would like to ask you more personal questions just to make sure what exactly is going on. So, is that okay if I proceed?
Sure.
So, can you tell me, other than your wife, is there any other sexual partner that you have?
No.
All
That's
right.
what I'm telling you, doctor. My wife is cheating on me. I'm not cheating on my wife.
Right. I'm sorry to hear that, Mike. Okay. So thank you so much for answering my questions, Mike. I would like to
So, doctor, I have fever as well.
Okay. And for how long you've had this fever?
From last 1 week.
All right. And for 1 week, have you seen any doctor
No,
for this? And
No.
did you check temperature?
no.
Okay. And also, have you noticed anything like this in your wife as well? Like, did she have any fever recently?
I don't know about her.
Okay. All right. So thank you so much for answering my questions, Mike. So what I have right now is looks like you might have some infection going on. Do you have any idea about it?
Yes, doctor, that's why I'm here.
Yeah, but like, do you know how does it like how I mean how it happens and how do we treat it? Like, do you have any idea?
No.
Okay. So also if so I would like to discuss this with you. Looks like you might have some infection going on, but I cannot really say, cannot be 100% sure what exactly is this unless we get your discharge, we scrape the discharge and we test it in the laboratory. And we also run some blood works on you to check if there is exactly what exactly is going on with you. In the meantime, I would also want you to know if there is any, the infection could be just a regular infection or it could be any serious infection like an STI, as I mentioned, sexually transmitted infections. In case we have those infections, I would really encourage you to talk to your wife and inform her about your condition when we have that report. Are you following me?
Yes, doctor.
All right. So if we whatever infection we find out, we'll definitely will treat it. There is a treatment available. We will prescribe you some antibiotics, and then you will have to complete the course. And then we will also require you to come back again and get a follow-up test done with us so that we find out that if you are compliant with your medications and if the test of cure, like to check for the test of cure. Do you understand all of this?
Yes, doctor, I am understanding. So at this point, you are not going to help with me with my wife, right?
No, I'm sorry, I cannot do that right now as I do not have any information. Even about you, I cannot be 100% sure what exactly is there unless I run some blood tests, right? So I'll definitely keep a follow-up appointment with you to discuss you the labs and to start you on some medications as well.
Okay, so if I bring my wife, will you do some test on her?
I'm sorry, I won't be able to help you in that regard, in that manner as well. As I said, you need to discuss first, you need to talk to your wife first, you need to communicate with her first. If she comes on her own and asks me to do anything, even if she wants to see me, that's when I can do anything, like, but I cannot give you any information regarding that.
Okay, if I ask you to help me to talk to my wife, can you do that?
As I mentioned, I'm so sorry, Mike.
एथिक्स का है, STI एथिक्स का है, कैसा हैंडल करते हैं पेशेंट को, पार्टनर को बोलना जरूरी है ना?
Just a second, let her finish because she has like 1 minute left. Okay, then I will answer your questions. Yeah, you can continue.
So I'm really sorry. As I said, I won't be able to help you in this regard. But if there is anything with the labs, we will definitely, as I said, I'll encourage you to discuss this with your wife, because unless if you don't do that, public health would definitely go and they will inform the wife. So yeah, let's wait for the results and let's get you tested. Okay.
Thank
you so much for answering my question.
so much. Thank you.
I think it's going to expire, this link.
Yeah, just in 1 minute. Kindly rejoin again, everyone, when it's just finished. I'm just waiting for it to finish. You did really well, I would say. I tried to ask you so many questions, but you really nicely, answered all of questions without being rude. One of the best thing here, I would give you like, extra points for that because you were not rude and answering all of the questions, even though my questions were stupid. So still you have to answer all of the questions what